Hi, I'm Mary Feldstein, Visiting Fellow for Healthcare Policy at the Goldwater Institute. The COVID-19 pandemic is stressing our healthcare system to the limit. It's making the chronic shortage of healthcare workers even more critical. In response, a number of medical schools are graduating their senior medical students early so they can help participate on the front lines. Medical training times have been reduced in previous crises as well. In World War II, 3 months were shaved off of each of 3 years of postgraduate programs, accelerating by as many as 9 months the time it took physicians to enter either civilian or military practice. There's no evidence that these physicians practiced any less skillfully than their traditionally trained colleagues. The shortage of physicians that existed before this pandemic is forecast to get even worse. The American Association of Medical Colleges predicts we will need more than 120,000 doctors than we can train by the year 2032. In the United States, it takes anywhere from 11 to 15 years after high school for a medical doctor to enter the full-time workforce, depending on their specialty. This is a year or two longer than many other advanced countries. If 3 months could be shaved off of medical school training and added to the 9 months that were saved during World War II, we might be able to graduate an additional 20 to 25,000 physicians over a training cycle. Even more might be gained if pre-medical collegiate training were taken into consideration as well. Now, it may surprise you to learn that the length of medical training has been arbitrarily determined and never has really been empirically tested for efficiency. There's no real economic incentive to do so because of the red tape that holds current state licensing regimens together. If there's any good that can come out of a tragedy like war or epidemics, it's that they help us focus on the common sense measures that can be taken to alleviate problems that persist when the catastrophes are over. If reducing medical training times can help alleviate shortages during the worst of times, then surely they can help when conditions improve. We need to seriously reassess the way we license and train healthcare providers. Thank you for your continued interest in the Goldwater Institute's response to the coronavirus pandemic.